Namaste. Now let us understand what is endometriosis. If we break the word endometriosis into three parts, then endo means inside, metrus means uterus, and isis means similar to that. So the abnormal growth of tissues similar to the uterus lining but which grows outside of the uterus is called as endometriosis. During each month at the time of periods, the uterus lining grows because of the hormones, and same hormones are responsible for the growth of endometrial tissues. Now each month during the periods, these tissues get shed inside, leaving scars or a wound at that place. While recovering from those wounds, there's a possibility that two parts of your body which are normally not joined together can bind together. For example, ovaries, fallopian tubes, uterus, intestines, these can get joined together in the abdomen, and medically we call this as adhesion. Because of these adhesions, one suffers through severe abdominal pain during periods. When adhesions affect fallopian tube or ovaries, it obstructs the egg growth or path, causing infertility. So, abdominal pain and obstructing of pregnancy are the two problems caused by endometriosis. Now, treatment of endometriosis is done in two ways. One in which we stop the monthly cycle of hormones, so the hormonal production is stopped. This stops the growth of all the tissues inside uterus as well as stops endometriosis. Patients are given contraceptive pills or injections for it. But in this treatment, we stop the natural course of producing eggs, because of which pregnancy is not possible. So most of the medical treatments for endometriosis obstruct the pregnancy because of the contraceptives being involved. The other way is to operate or make a surgery. Patient needs to get operated when she is suffering from severe abdominal pain or there is a cyst formed by endometriosis called endometrioma, or in the case of adhesions where ovaries, fallopian tubes or uterus are joined together or fallopian tubes are closed. At this stage, we perform an endoscopic operation to separate those internal organs which have been stuck together or to open up the fallopian tubes. After this operation, there is a possibility of conceiving pregnancy through IUI or IVF treatment. In a way, pregnancy is also considered as a very good treatment for endometriosis. That's why it is often called as gold standard treatment for endometriosis. It is called so because during pregnancy, patient doesn't get periods. So it obstructs the cyclic growth of endometrium for 9 months of pregnancy and next 3 to 4 months of lactation. So approximately for 1.25 years, the periods are stopped. This prevents the growth of endometriosis, and that's why pregnancy is considered as the best treatment for endometriosis.
अपॉइंटमेंटसाठी कॉल करा 99 22 432 972 किंवा भेट द्या www.ivfcare.in. आजच संपर्क साधा.